Hello everyone, so I'm Pete Lunn. I'm the head of the Behavioural Research Unit at the ESRI. We're a team of about, at the moment, 8 mixture of behavioural economists and psychologists. If you're interested in our work, there's a link to it down the bottom there. I'm going to talk today about collective action problems. There is an increasing recognition that what's happened to us recently in this extraordinary year of 2020 also comes with some opportunities as well as the huge challenge that we are currently facing. And one of the opportunities it comes with is the possibility of us learning how to better coordinate collective action among citizens to face major problems. And that's primarily what I'm going to talk about today. You will see a variety of terms associated with what I'm going to refer to throughout as collective action problems. Common pool resource problems, prisoner's dilemma, social dilemmas, public goods games, coordination problems. All of these terms have been around in behavioral science for a few decades, and they all describe circumstances where somebody's individual incentives are at odds with the best collective incentive. And I'm going to treat them all as if they're the same. There are slight differences between them. So for example, common pool resource problems are about individual incentives for using up a resource that is a common resource, whereas some of the other problems here might be more about people contributing towards a common pool. But essentially, all of these describe situations where people's individual incentive is at odds with some kind of collective incentive. So let's give it a proper definition. And so let's look at Wikipedia's definition of a collective action problem. Collective action problem, or a social dilemma, is a situation in which all individuals would be better off cooperating but fail to do so because of conflicting interests between individuals that discourage joint action. This is unfortunate, I think. Wikipedia I use regularly and is generally often quite a useful source of information, but the idea that you would define a problem by failure to solve it seems to me to be pretty intellectually vacuous, and in this case is in fact wrong. This is actually very unfortunate. It is a legacy of, unfortunately, the way economics has been taught for a number of decades, where it was simply assumed for a long time that when facing a collective action problem like this, people would simply fail to solve them, that selfish incentives would always win out, that cooperation wouldn't be possible because people respond to incentives, and therefore, even in this day and age, Wikipedia has a definition that says that a collective action problem is something that people fail to solve. Here is a better definition. We're going to push that one away, and I'm going to show you that empirically in a moment, because of course, what's actually true is that that's an empirical question. We don't know until we test it whether people can or cannot solve collective action problems. So I'll give you a better definition. Collective action problem is a situation where individuals need to override self-interest and coordinate to achieve a superior collective outcome. So the question becomes, can they do it? And as I say, that's not a question of definition, that's a question of empirical fact or otherwise, or under what conditions can people solve them and what conditions can people not solve them. If you happen to believe that they're not solvable, that somehow we can't override people's selfish instincts, let me tell you something quite interesting. So I want to talk briefly about quite a famous experiment, the Marshmallow experiment, or Marshmallow test as it's called. This is the way it worked. Many of you have almost certainly heard of this experiment, and you'll realize why I'm talking about it in a moment. But just to give you the basic idea, this was originally done with preschoolers at Stanford University, and they were given a marshmallow in a very empty and boring room, and the experimenter gave them marshmallow and left for 10 minutes and said to them that if they didn't eat that marshmallow for the 10 minutes the experimenter was out of the room, they'd get 2 marshmallows when the experimenter returned. So this is a test of whether the child is willing to be patient and delay gratification in order to get a superior reward. And in fact, this is a very famous study because some of the children managed to do it and some of them didn't. And they followed up to see what impact this ability to delay gratification as a preschooler had on later life outcomes. That's not my interest here. You'll see what my interest is in a moment. But I mean, we'll just follow this kid here through. So here's the kid in the experiment. Obviously, the experimenter leaves the room and he really wants to eat the marshmallow. It's pretty tough going. It gets increasingly difficult as the minutes go by until it's becoming genuinely painful, and he's touching the marshmallow but not eating it. Some kids in this experiment actually licked the marshmallow and didn't eat it. Some of them did eat it and didn't get 2, but this guy despite going through the pain he's gone through. Eventually, the experimenter comes back in, he managed his 10 minutes and he gets 2 marshmallows. Now, why is this interesting in the context of collective action problems and health and environmental outcomes? Well, only this year, there was an experiment done that's published in Psychological Science by Kuhlman et al., and they changed the way this worked. They had 2 children instead of 1. And the 2 children had met for a bit and played together for a little bit, and then they were separated, and they were both given the marshmallow problem, as you can see in the example above. But they were told that, and in this case, actually it wasn't marshmallows, it was cookies, but they were told that they would only get the second marshmallow if both of them delayed gratification and didn't eat the cookie that was in front of them. They'd only get the second cookie if both of them didn't eat the cookie that was in front of them. So compared with a situation where there's just one child, actually their chance of getting the second cookie is lower, because not only have they got to not eat the cookie that's in front of them, they've got to rely on the other child also doing the same and resisting temptation and not eating the cookie. So the individual incentive actually to eat the cookie is larger. The individual incentive to fight and delay the gratification is less. Yet, clearly the best outcome for both of them is if they can both delay. And here's the really interesting thing. Actually, in these circumstances, even though the incentive is less, children are more likely, not less likely, to delay gratification than when there's just one of them and they're just doing it for themselves. In other words, even at age 5 or 6, children understand when they're in one of these social dilemmas, when they're in one of these collective action problems, and actually respond to it. Even when they've got to fight their own temptation, they actually respond to it better when they're partly doing it for someone else and trusting and relying on someone else. Or more succinctly, even small children know when Wikipedia gets it wrong. Empirically, the truth of the matter is that human beings frequently do solve these kind of collective action problems, do make sacrifices for the common good, and reach the socially better outcome. And that's why we shouldn't be defining the problem by the outcome when we haven't yet tested it, or in fact, when people have tested it, it's not right. In fact, it turns out that people can cooperate to achieve socially better outcomes. Okay. The rest of this talk, having established that as a framework, really rests on 2 claims. And if you don't buy these claims, then you can go and get a cup of coffee, because the rest of the talk is not going to mean a huge amount to you. But I'm going to make the first claim here as follows, that the public response to COVID-19 has been remarkably cooperative. So yes, there's been a lot of focus, indeed, even in the last week or 2, on instances of non-compliance, particularly caught on video and put on social media or outside pubs in Dublin and Cork and so on. But overwhelmingly, the large majority of the population have consistently made sacrifices of their individual well-being in order to reduce infection for the collective good. In other words, this is a classic collective action problem where we're trying to coordinate our behavior for a common aim, and people have been remarkably good at doing it on average, or in the majority. And the second claim that I'm going to make is that if we could even come close to these kind of levels of cooperation and coordination on issues like antimicrobial resistance or climate change, it would make a huge difference. So the rest of this talk is really about what can we now learn about these collective action problems that helps us to go forward and try to solve other collective action problems that are in this space. So one of the questions we might ask is, why has cooperation been so good on COVID? And there are some good answers to that. So behavioral scientists have studied these kind of collective action problems now for about 30, 40 years. And it's pretty well understood when cooperation is more likely and when it's more likely to break down. When do people make the sacrifices and when do they not? And there is a good fit, in fact, to the known factors here. And first of all, cooperation is much more likely in these kind of collective action problems when there is clear and repeated communication of what is the best strategy for all. In other words, the aim is made clear of what we're trying to achieve as a collective, and how our individual behaviors link to that aim. The cause and effect has to be outlined in a way that people can clearly see and understand. And I think in the case of COVID, although transmission has some elements of complexity, there are some things about it that are pretty simple and straightforward, that we do know that it's to do with how close you get to people, that it's communicated through respiratory means, that therefore good hygiene is important, and so on, all the things that we've heard. And because we can clearly articulate what the goal is here of flattening a curve or reducing the overall level of infection, and we can see clear links to cause and effect that can be articulated, the communication of why this is a best strategy for all, in the case of COVID, has worked reasonably well. And that's known to be, across multiple collective action problems, an important aspect. Is how clearly can you articulate why a particular behavior, if everybody does it, is best for all. And if that is clearly and repeatedly articulated, you are more likely to get that behavior. There's also the group identity element to this. So we know that the stronger the collective group identity that is involved in the group that's trying to coordinate for the greater good, the stronger that group identity, the more likely people are to follow it. Now, in this case, we have an advantage because there's a degree to which this is humans versus the virus. I mean, our collective identity is all of us as humans. I want to make one very small point to you that I can't prove. And I think it's probably going to be true that academics are going to argue for the next 10 or 20 decades about what factors led some countries to do better in keeping COVID cases and deaths lower than other countries. One thing that I think is particularly interesting, and I predicted before the pandemic even really got going, is that smaller countries with more cohesive identities would on average do better. And when you look at the data, that is exactly what's happened, particularly smaller countries that sit next to larger, traditionally more dominant neighbors. So take Canada versus the United States, take Ireland and Scotland versus England, take Denmark versus Germany and Sweden, take New Zealand versus Australia. In all of these cases, the smaller neighbor has done better at containing the disease than the larger one. And I'm going to argue that some of that is to do with, and I can't prove that obviously because there's so many factors involved, but it's some coincidence that it's all turned out that way. And I think that was predictable based on how much more cohesive the collective identity within those societies might be. And finally, in terms of known factors, another known factor in solving collective action problems is the visibility of behavior. In the case of COVID, we're dealing with very visible behavior with whether people do or don't comply with restrictions. And a lot of the enforcement there is therefore just straightforwardly social. You know, it's social disapproval. It's even just looks and glances at people who are not behaving the way they're supposed to. You've probably had the same experience as me of being in a supermarket queue where someone gets a bit close to you. All you have to do is catch their eye at the moment and they'll realize what you're implying and they'll take a pace backwards, or at least the large majority of people will. And that also helps that there's that degree of sort of very low level punishment for indiscretion that can be corrected through primarily social means, sometimes slightly stronger means. And again, there is a whole strain of research that shows that even without centrally enforceable punishment, collective action problems are more likely to be solved when behavior is visible and other people can socially police it to some degree. There are other factors that really matter here, though. I mean, obviously, one of the reasons it's possible during COVID, and this would be much harder for something like antimicrobial resistance or climate change, for example, is we've got a crisis that focuses everyone's attention. Everyone's plugging into the same media outlets, particularly near the start of the crisis. Everyone's hungry for information. There is an event, a timing that brings everybody together to focus their attention. And furthermore, the relevant outcome is close to immediate. I mean, whether infection does or doesn't happen is a matter of days and weeks. Whereas when you're dealing with antimicrobial resistance or climate change or a problem like that, you're dealing with decades. And it's important also to understand here that behavioral scientists actually know less about the role of any coordinator. We've studied these kind of collective action problems and how coordination appears essentially spontaneously among people, among small societies. There's less that's known about the role of the coordinator. And in this case, of course, for COVID, you're talking about public health officials and governments. And of course, in most of the problems we're interested in as policy problems, we're talking about governments too. But the degree of trust and the kind of history, as it were, of communication and the relationship between the government and the people, that is less well understood and may well be a factor that's extremely important in solving particularly the longer term kinds of collective action problems that I'm talking about. So we have a good idea about some known factors that help in the case of COVID, some of which may or may not apply, and I'll come back to that, to these other problems we're talking about, these bigger environmental problems. And we know a little less actually about the role of communication from a central coordinator as opposed to between the group that's trying to solve the problem. Okay, so if we take as read then that one of the really important things, and that's been shown in COVID, is that having a clear aim where people can see what we're trying to do and how their behavior has a cause and an effect towards that aim. We can see that when we go to a problem like AMR, or when we go to a problem like climate change, there's a really big science communication problem there, much more difficult than the problem, I would argue, of disease transmission in COVID. So we can learn lessons from COVID and elsewhere about how we might solve that, but it's a bigger challenge in the case of these larger, I would argue, more technical, more scientific problems. One of the huge difficulties here is what I would refer to and what behavioral scientists call the curse of knowledge. That is that often the people who are trying to communicate the science to us, their biggest problem is that they understand it and they find it extremely difficult to put themselves in the shoes of somebody who doesn't. The curse of knowledge is the difficulty of getting across to somebody something that you understand because you don't understand what it's like to be them. You find it hard to put yourself in the shoes of somebody who doesn't get it. And how we communicate knowledge is an extremely important part of trying to solve a collective action problem. That means we need to measure public perception and understanding. And I think that's been quite well understood throughout COVID. And indeed, my lab has done quite a lot of work in that space. I don't think we're anything like as far down the road with things like AMR and climate change of genuinely understanding how much the public understands of these things, how much the public understands of the cause and effect that's involved, and also particular groups such as patients, doctors, farmers, vets who are involved and have key roles in something like antimicrobial resistance. How well do they understand the problem that they face, and what do they perceive to be the causal relationships behind it? Those are things that I think we could learn a lot more about. We do know that the more simple you make these relationships, the more simply you describe them, the more likely it is to lead to behavior change. So that collective response, people being willing to make their sacrifices for the common good, more likely when the communication is simpler. And we also know that stories really matter in that science communication. So again, going back to that curse of knowledge, it's really tempting to try and get across in a kind of educational way the technical elements of the science, where actually maybe a much more simple narrative will be more powerful. I only have to put that picture on the screen and everybody knows who that is. And in terms of trying to get across the situation we face in climate change, I don't know how climate scientists feel about it, given they've spent years and years trying to get that science across, when actually a small girl comes along and turns it into an intergenerational story, a plot with some narrative, and you get so much more attention and engagement with the problem. So narrative is an extremely important part of trying to communicate some of that science. Can it be done for something like, for example, AMR? Well, one of the problems here is that the best strategy for all, it seems to me, is not clear. What is the primary goal that we're trying to achieve? Because obviously, if we're trying to reduce antimicrobial resistance, the absence of a problem unmeasured is a rather weak, rather abstract goal. So can we articulate a stronger goal? I mean, and the climate change movement has begun to do that in recent years. So some kind of equivalent of the keeping the temperature change down to a certain amount. It's like a target or a goal. And what this collective action research would suggest is that if you can have a clear target or a goal, it's going to help. Cause and effect, can we get people to really understand how one thing is leading to another within the collective action problem we face? And can we mobilize narrative examples to get that across, to communicate it? And I would argue as a behavioral scientist, can we test those and show that they're improving people's comprehension? What can we do to foster group identity? Well, we do have the fact that it's humans versus bugs. That's an advantage over something like climate change, where quite often we're dealing with humans versus humans because it's a human-generated problem. And enforcement, clearly one of the advantages with a case like antimicrobial resistance is that we have a degree of professional oversight associated with the way antibiotics, for example, are prescribed. And therefore, the possibility of engaging with right levels of enforcement and putting in place greater oversight of people's behavior within the collective action problem, we might be able to mobilize some of that in order to get better coordinated action. So can it be done for AMR? Possibly it can. But if we understand the nature of collective action problems and we can break down the drivers of people's behavior within them, as I'm trying to do here, I'm going to argue that we're going to do a bit better. So to conclude, human beings can make sacrifices to cooperate in the face of threats. And our response to COVID-19 shows that. And there are many other examples as well, including small children not eating cookies. It's a real opportunity. What's happened now is a real opportunity to learn about how and why. I do know there's now multiple international conferences that have been planned precisely to try to take the learnings from our response to COVID-19 and try to apply them to some of these bigger environmental problems. And the European Commission is very interested in this. And this is a real opportunity to see whether we can learn more generally and perhaps communicate better about ways of solving collective action problems better. So this is an opportunity. And I would argue, unsurprisingly, a behavioural scientist arguing for a role for behavioural science, but I would argue very strongly that there really is a role for behavioural science in the science communication here, where we are trying different ways of communicating to solve collective action problems and testing their impacts and measuring the impact on people's perceptions, their understanding and their willingness to cooperate and engage in more collaborative behaviour and in promoting more collective solutions. So that's a fairly conceptual talk based on recent months. I hope you found it interesting. Please do use the app to ask some questions and we'll come back to those a little later. Thank you very much.